when we talk about the biomarkers, we need to define what are the biomarkers, what's the meaning. So we have a diagnostic biomarkers that detects or confirms the presence of the disease or conditions of interest. Monitoring biomarker is when you measure the biomarkers in the different, multiple times to assess the status of the disease or medical condition. When we talk about the response biomarker, when the level of the biomarker changes in response to the exposure or the treatment. Predictive biomarker defines the finding that defined by the finding that the presence or change in the biomarkers predict the individuals or group of the people are more likely to experience favorable or unfavorable effects from the treatment or exposure. Prognostic biomarker is used to identify the likelihood of the clinical event, disease recurrence, or progression. When we talk about the bladder cancer biomarkers, so for bladder cancer, there are different stages of the disease. People come with the hematuria. They come, diagnosed with a low-grade non-muscle invasive bladder cancer or high-grade non-muscle bladder cancer. For people for hematuria, we need a biomarker. Then we said, okay, this is very sensitive. You need to go to the cystoscopy, more evaluation, or you don't need to the cystoscopy. There are a few biomarkers on that area. They already have some data. I'm going to go over some of these markers. For low-grade non-muscle invasive, the most important biomarker is that if we can delay the cystoscopy, instead of we offer in our patient every 6 months cystoscopy, can we delay it for 1 year? And of course, for high grade is more, we do the cystoscopy every 2-3 months. But the question is that if the cystoscopy